Hello and welcome to this edition of Piedmont Business Live. I'm your host, Ken Morrison, and today we are talking with Glenn Huth of Stoney Creek Veterinary Hospital. Glenn, thanks for being with us.
Well, thank you for having me.
Tell me first about your practice. Where and when did you open Stoney Creek Vet?
We opened Stoney Creek Veterinary Hospital in 2001 in the Whitsett, kind of McLeansville, Gibsonville area between Greensboro and Burlington.
So why did you choose that location?
Well, I knew I wanted to open up a practice, and my dad had some ties into Stoney Creek. He lived there, and by spending time over there, I realized it was a really growing, developing community, and it did not have a veterinarian right there in the area. I found that a lot of people in the area were driving into Greensboro, Burlington to get their services, so it seemed like a good place to have a leap of faith, because we opened up a startup practice pretty much, not many clientele at first, and so but it's been a lot of fun.
But that area is really booming. The housing and everything. It seems like Greensboro and Burlington are kind of meeting there.
Right, and that seemed to be why I felt like, there were a few smaller veterinarians that, had been there for a long time, and they, but the area needed kind of what I would consider an upscale veterinary hospital. So again, took a leap of faith, and it's been really, really a blessing,
Do you have any specialized areas of practice?
Well, as far as terminology, specialized classically means that as a veterinarian I've gone back to school and done additional education. I have special interests in certain things. I do enjoy and do a lot of surgery. We do a lot of kind of maybe alternate modality type procedures as far as I use laser in my surgery room for most cases, which is a surgical laser, which is scalpel free in most cases. So the laser provides a less painful, more rapid recovery with the surgery. We have electromagnetic beds that these animals can recover on that helps them recover faster and less pain. We have post-surgical laser for therapy. And then I do a fair amount of exotics. Now, one of my loves is doing wildlife work, but that's volunteer work. But it's incredibly, it's a joy to do, and I really enjoy doing it. So.
Now, what sets Stoney Creek Veterinary Hospital apart from other veterinary practices?
Well, I think there's a few things. One, even though in 2001, when I opened, I was one of 3 staff members and a groomer who's still with me today. And now I've grown into a 30-somewhat employee practice. Many of the people have been with me for over 10, 12 years, almost since the beginning, some from the beginning. We're very family-oriented. We work well together. We're a Christian family in most cases. And I think that helps build us as far as being strong in unity. The other is that I always try to think about where our profession is going and what we can provide for the patients and the clients, and how we can do that the best for the patient. I have a rule of thumb that I typically practice medicine by. It's very simple. I have 4 things I always look at. What does it cost the patient? Obviously, your dog or cat's not paying the bill, but they are paying a price, and are we doing this right? And then the other 3 things is what's it cost the owner? Physically, is there a limitation that the owner cannot do this, and so I need to find an alternate route? Emotionally, because that's a huge thing for clients. Where is this going? How am I affecting this client emotionally? Make sure I'm not doing this because I want to do it. I want to do it because the client needs this. And then also making sure that the client's not doing something they shouldn't be, that they're going to emotionally have to deal with down the road. And then financially, trying to help that as much as possible. So kind of that balance, we try and stay very modern. We're always looking at newer equipment. And the equipment doesn't always make you better, but it does help us provide the best possible care.
Gotcha. What other services do you guys provide that people might want to know about?
Well, I mean, we have the new facility coming, which I think we'll talk about in a minute. But as far as Stoney Creek, the hospital, as I mentioned, we do surgical laser, which I think, is a difference. I'm not the only one, but I think it's a step in advancement. Therapy laser is a big part of our practice now, and it's not just for the ouch, knee, ankle. It's wound care. It really advances the healing properties of all that. And then, obviously, again, as I said, trying to stay ahead, trying to think about where are we all going. One of the things that I think will tie into our new facility is I'm very blessed with what I get to do, and because of technology and because of what clients are willing to do, we're keeping our pets with us longer. Right. And that is a blessing, but in another way, it's a bit of a curse. Veterinary medicine, I've been in it now for over 30 years, going back from kennel kid to technician. And though you don't think about it much, there is an age difference. Dogs are living 2 to 3 years longer. It doesn't sound like a lot, but when you do the percentages, it's like you and I living another 15, 20 years.
Right.
And as it's happened to us in the human world, in the pet world, we're dealing with geriatric health. And unfortunately, geriatric health most of the time doesn't have a silver bullet fix. Right. It has what can we do to maintain the quality of life? And that's an important thing, and that's how I live my life in my practice, is QOL. Quality of life, is this right to do? And so, as we now learn and are seeing, we've got more heart patients, more blind patients, more deaf patients, and unfortunately for me, the thing I'm passionate about really is just arthritic and sore, and many of these animals, they're not given much of a choice, and I want to try and give them a choice,
And people care for their animals about as much as they care for each other.
Sometimes more. Yeah. And I think one of the points I'd like to get across as we, kind of work forward in this, new ideas that I have is, and it's not a bad thing, but our dogs and cats, especially our dogs, they don't get to choose their life. They follow whatever it is we provide for them, and they're really patient with us. I often joke with folks, I'm married 25 years, and I know my wife loves me every day, but there's some days she doesn't jump up and down for joy to see me. My dog does, But that's sometimes the only life they have. They sit and wait for us to come home,
Yeah. I always say that nothing beats the loyalty of a dog.
Mm-hmm. You're exactly right,
Well, tell me about this pet lodge.
Okay, the pet lodge was something that has been kind of flying around in this old brain of mine for the last few years, and I've always felt like the idea of daycare for animals is a good thing. And I know people think, oh, that's kind of silly, but again, back to the idea of what is your dog doing 5-6 days a week? It's just sitting around waiting for you to come home, and most of the time we come home and we're chasing our kids around, we're chasing life around, and they maybe get a few-minute walk, but then we have behavioral problems. They bark, they chew, they jump, they don't listen, but it's because they don't have an outlet. One of the things I say to many people is, especially a dog needs a job. Now, that doesn't mean you have to, to train it to be something or, take it to agility classes, but the dog needs something to occupy its brain. I mean, if as parents, you think about if your kids are cooped up, there's a point when you find like, oh my gosh, we've got to go out and find you something to do, My wife used to call it the gym jams. Get the gym jams out. So, for that part of the lodge, we're providing daycare for animals to come in, and we have multiple outdoor play areas. We have the in-ground swimming pool, kind of a water park that dogs can engage and play in. And we'll have trained staff that will identify what is this dog's weaknesses and strengths. We are going to make sure that everybody that works for us is dog behavior trained, meaning there's actually an online course and then a test to take that they can identify what we call green, yellow, red. Green light, dogs are fine together. Yellow light, there's your warnings because you never want to get to red light, And I think that will be a benefit. So these dogs, we can identify the dogs that need a little extra time to kind of get used to this playtime. Because again, we assume our dogs are going to do great together, but they sometimes don't. And then the pet lodge itself. We've got a fairly upscale boarding vacation facility for your dogs. These are suites, some of them with TVs in them. They all have cots in them. There's ones with indoor, outdoor areas. And, there are no cages anymore. And that was one of the things in the veterinary hospital that we just can't provide. The space just is limited to what we can give. So this provides people that don't want to just put their dogs in a small space. And even if they get outside once in a while at the boarding facilities or hospitals, I'm trying to offer pretty much the kind of elite opportunity for these animals to stay. We'll have the ability for social networking if clients want updates every day. Special nighttime treats. There is a live-in attendant who will be checking on these animals, so there'll be an evening walkthrough sometime between 10 and 12 o'clock to make sure everything's going okay. They can have prearranged pickup or drop off if it's off hours, someone's getting a flight back late. If we know that they're coming, we'll be able to have the attendant meet them. And then my part of the building, which is the rehab component, Stoney Creek Rehab Center. It's a referral rehab center. And what does rehab provide for an animal? Well, there's different categories. One, which I guess as I've gotten older, just the arthritic component. And it gets back to the idea that our dogs don't choose their path. I hear it way too often, well, we used to go for walks, but she seems like she gets stiff, so we don't go anymore. And I understand where the heart's coming from that client, but they're missing the point. And also sometimes it's time. We're back to the other thing, what am I asking the owner to do? Do they have the physical limitations that won't provide the ability to take these dogs for these trots? Because look, walking's okay, but most of our dogs, they walk and they Miranda and they stop and they sniff. And so, we need a little bit more. And I realized that over the years. I keep telling people, well, you need to do more to get your dog's activity up. Your dog's overweight. Oh, common conversation. But I never really provided folks with an option. And so this will become an option for them. This rehab facility is an arthritic center for geriatric patients, so we're going to have a geriatric center, kind of like geriatric playtime. But we have a water treadmill for these dogs to be in. We have a dry treadmill. We have the swimming pool. And then we have the therapy center. So arthritic, weight loss, all right, go get weight off your dog. How? How do I do that, doc? So now we'll give some folks options. And then the post-injury and post-surgery. We've got animals that come in that have, either had surgery or have done some type of trauma and don't want to do surgery. We have the capability often of helping these animals regain structure and maintain quality of life. Working with the sports agility people. There's a lot of sports dogs out there, and they get repetitive injuries and they need conditioning. This is a reconditioning facility.
Do people have to be a client of Stoney Creek Vet Hospital to be able to bring their pets to the pet lodge?
Well, for the pet lodge, no. As far as the boarding facility and daycare, anybody's welcome. Obviously, for the boarding part, we will need to have up-to-date vaccine history, which they can get done anywhere. For the daycare facility, same thing, anybody's welcome. We will incorporate first visits usually where we want to have just a short stay, the owner's with us, because again, we're back to our green light, yellow light, red light. And I know many folks want to have their dogs in daycare, and I want to be able to do that, but I also don't want to, what's it costing the animal? Back to number one, most important. And though an owner may think they want that dog to be in daycare, if that poor dog sits there with its tail tucked against the wall because it spent 8 years of its life in the house all by itself, in a backyard by itself, and you suddenly put it in a room with a bunch of running around happy dogs. That doesn't mean that dog can't make that transition, but we want to be able to communicate to the owner, saying, okay, look, here's what we have. Maybe we want to do more individual time. Maybe we want to separate this dog out. It doesn't change cost of those things, but we want to be able to communicate with the owner because the goal of this is to make this the best possible experience for the animal. So for that, pretty much that would be the only requirement for the owners. And now for the rehab component, yes. There does have to be a relationship with a veterinarian. Now, not me. It could be, we are a referral base. I want to help all the local veterinarians that have post-injuries that they're trying to deal with, a back dog that is recovering from surgery or maybe needing non-surgical help. If I have an animal that comes in for the arthritic center or weight loss center, I will require a referral letter that says this animal is healthy enough to get in the treadmill or do some of these work, or we'll have to have that veterinarian see that animal first before we get that, because we can make sure the health of the animal. And then, for the referrals also, we will be offering veterinary acupuncture, veterinary chiropractic work, veterinary massage, and then my component, the rehab. So all of those things will require some level of referral from the associate veterinarian.
Well, it sounds to me like if I bring my dog to the pet lodge, he's not going to want to come home.
I think so. I think that's the thing we're trying to provide. We're trying to provide a vacation for your dog. We're trying to provide that this dog has an outstanding experience and enjoys itself, and you can be assured as you're away having a good time, your dog's also having a good time as well.
So when you say, do you want to go to the vet, the dog actually jumps into, into the car.
And we have actually seen this. We've talked with other facilities that have been very helpful and honest. And when you see your child run away to go into kindergarten and they don't look back and okay, I've made the right decision, that's what I want these animals to be doing as they drop off for daycare or boarding. They want to be there. They're happy to be there. I want them to go home and be tired. I want them I want that phone call from the owner, whoa, he slept for like 2 days when he got home, because most of us, when we get home from vacation, need a vacation from our vacation. So
when do you expect to have it open?
we are hopeful to be open sometime mid-January. Obviously, things have been going well with construction, but as we all know, anyone who's done construction, anything can happen, but things have been moving well. So we will just miss the holidays. However, if I can make a quick plug, in early December, we will be offering gift certificates. You can get them through the Stoney Creek Veterinary Hospital. So if you have friends or family that you think that their dogs would benefit from the daycare facility, we'll be selling gift certificates for that. And then actually, we'll also sell gift certificates for just services at the lodge, because if we do have an animal we think that needs rehab and people want to do treadmill. And look, the treadmill work is as simple as if you have an old dog that you want to try and get some exercise with, as long as it has a routine physical exam recently cardiac and is okay. We typically schedule those once or twice a week. You come in with your pet, you sit there while we're in the treadmill, you take your dog out on our walking trail and do a cool down, and then dry off so your wet dog doesn't get in the car, and home you go.
Excellent. Well, Glenn, thanks very much for telling us about Stoney Creek and the Pet Lodge. And if you would like to know more about Stoney Creek Veterinary Hospital and the Pet Lodge, then please visit the website. It's at the bottom of this page and also at the end of this video. Thanks very much for tuning in to Piedmont Business Live. We'll see you again next time.